Thank you very much. I will give you a short update on the Swiss Hepatitis Strategy, and first I will have a look back. We have actually a trend towards elimination, towards more awareness on viral hepatitis since about 10 years. 2011, the WHO proclaimed for the first time the World Hepatitis Day on July 28th, a day we have now every year as an important platform for our campaigns. In 2012, we had the first antiviral therapies that against HCVs as well in Switzerland. In 2014, WHO released the first resolution on viral hepatitis and called there on the member states to act to implement national plans to fight viral hepatitis. And finally, the Global Health Sector Strategy Plan of the WHO in 2016, really a milestone, because here you have the elimination goals, the elimination vision, and it shows that viral hepatitis on an international level is treated now on the same level as HIV and STIs. This is an important signal also for us. Now, where comes the strategy, the Swiss Hepatitis Strategy in? It began almost 5 years ago. It became clear to the experts also in Switzerland that something has to be done with this raising awareness internationally. And 40 personalities came together in January 2014 at the kickoff meeting. Michel Kasatchkin joined us too, and there was also the former health minister Ruth Dreifuss who was there. And they reached actually an immediate consensus that we have to act, something has to be done. And that was when the network Swiss Hepatitis Strategy was born. In the same year, 2014, we released a first strategy paper. We are now currently working on a fourth update of this paper. And also already there we had elimination goals. We were quicker than the WHO a little bit with elimination. So what results we reached so far? You heard already a lot about the strategy, a lot of voluntary work, very limited resources, but we achieved, we could raise slowly the awareness. We had almost over 150 articles in the media on viral hepatitis, mainly, of course, the discussion about costs, but we also had portraits of patients and in general on the disease. I mentioned before the strategy paper we released, and we had from the beginning the idea that we want to include very, very different views, people from very different backgrounds. It was clear for us that not one organization or one view or one medical association can solve this problem. We have to include everybody from the medical field, politicians, patients, insurances, pharmaceutical companies, and so on. And that bore fruit. For example, patients then decided to found their own organization. We heard them before, Christoph from the Swiss Hepatitis C Association. They do an important advocacy work, and they do also peer-to-peer counseling for patients. Since last year, we have some funding of the Federal Office for Public Health. It's not much, it's not enough, but it was a step, it's a signal, and we hope to increase this. And as you, of course, know, we had this important milestone of the lifting of the limitatio in October 2017. We, as a network, did a lot of background work there. We could achieve that. There were several several expert roundtables took place, and I think we really had also our part in this achievement. Our network grew. Today we have over 30 partnering organizations, among other all the university hospitals in Switzerland, and also, for example, the Swiss Conference of the cantonal directors for public health who are joining the network and supporting the goal of elimination. Now, despite all these achievements, we have still a significant burden of disease due to viral hepatitis, around 80,000 people affected by HCV or HBV or both. The mortality due to hepatitis C is 5 times higher than of HIV, and it's still a major reason for liver cancer and liver transplantations in Switzerland. And also, you saw it before, we have, due to chronic hepatitis C infections, people who are suffering from a lot of symptoms that are not all related to the liver, and they reduce the quality of life. They can also have a negative impact on their working ability. Gaps, we were talking a lot about gaps. We have gaps, we still have gaps. You see here the situation end of 2017 for hepatitis C with a viremia of about 40,000 people. 2/3 only are diagnosed by now, and only a fraction, about 3,000, end of 2017, were treated so far. So it's a lot to be done, and it shows elimination is still quite far away. We have a new modeling study by the Federal Office for Public Health, which was looking at screening strategy. In Switzerland, we have a risk-based screening strategy. This is the baseline scenario you see here. And they were modeling other screening strategy, and it's clear that with alternate screening strategy as universal screening or screening that is targeting a certain birth cohort, we would be able to decrease viremia in the population much, much faster. So our risk-based strategy at the moment is just not enough, but there are a lot of question marks. We have not all the data we need. The big question is also the feasibility, which strategy is feasible, and we just do not know who are the undiagnosed. We have only assumptions here. Now, the network is acting. We are very much aware of all these gaps, and we defined some projects. We heard before of the Swiss HCV trial, which is trying to eliminate this gap among MSM with micro-elimination. Then we have a new study we want to launch, which is looking at this gap of the screening strategy. So which alternative screening strategy could be more feasible and could be more effective than the current one? It's a project, a study we want to launch right now. We are ready to launch. We have a project that is called HepCare. It's targeting the general practitioners. We want to increase the pool of the physicians that are providing hepatitis C treatments for their patients, and the GPs are there very important. At the moment, they can't prescribe hepatitis C treatment, but they could actually do the hepatitis C treatment with the help, with the assistance, with the counseling of a specialist, and we want to promote this in Switzerland with this project. Then we have a project which is targeting the follow-up. What happens when somebody is cured of hepatitis C? We know that some people do have an elevated risk for liver cancer and other diseases, and we know that we need better and more detailed guidelines. And last but not least, very important, you heard it before, the prison setting around Claude Scheidegger. There is a group who is at the moment thinking or building up a platform, establishing a platform with possible activities around the prison setting. Now, are we on track? We had good news actually in spring when a study was released at the EASL that Switzerland is now one of 6 countries that is on track to eliminate hepatitis C. That was after the lifting of the limitatio with universal access, which is great news, but as the author said, all of the countries must do more to sustain and improve this progress. That is an important message, because if we look at these figures here, these are the treatments, number of treatments of hepatitis C in Switzerland, also projection. The source are the sales of the medications. And you see here, when the limitatio was lifted, or before that, with the loosening of the restrictions, we have more treatments in Switzerland, but now we have a trend downwards, and this is not good. That means we have still patients that are diagnosed but not referred to treatment, and we have still many patients that do not have a diagnosis. Here we have to do better, because if not, we won't be on track to elimination very soon again. Viral hepatitis is still a silent disease, despite awareness raising and many efforts in Switzerland. We had here a commentary. We could write an article in the NZZ about it, that really now is the time we should do something about. We heard it before. We had many discussions in the media on the costs of the treatment. Now that we have universal access, we don't see viral hepatitis so much anymore in the newspapers, but awareness is key for elimination, awareness for everybody, for healthcare workers, for patients, for general populations. We need more awareness to achieve the elimination goal. Again, we heard it before, we have the tools, we have everything ready, we know we have plans, we have projects in Switzerland. So in conclusion, I can say we have a very highly motivated network here who is ready to work, who is ready to act. We have a clear and widely accepted goal of elimination. We have plans, we have projects, we know what to do. That is the plus side, and the negative side is we need more awareness, and hepatitis should be treated on the same level as HIV and STIs. So everything is ready, we can do it, let's do it. Thank you very much.